Okay, today we're going to demonstrate how to take a Facebow, and it's a very simple procedure. It's so that we can transfer information about the patient to the laboratory, and then they can use it to set an articulator, which is a device which reproduces jaw muscles. So the first thing that we need to do with our patient is to get a little reference mark. So I'm going to do that with a specially shaped ruler which has a little notch cut out of it. The Facebow system we're using is the Denar system, and technically it's called an Earbow. There are other systems around, but the Denar is the one that's the most commonly used in the UK. So we open them and put a little dot there which lines up between the notch between the central and lateral incisor and the inner corner of the patient's eye. And then if we measure that, and in this case, in Nicole's case, it's 21, and we can always record that in our patient's notes for future reference. So that's done. The next thing we need is a bow, and you can have them either way round. That way's the wrong way, that's the correct way, so that the bar that comes out is on the patient's right. We use some quick setting bite registration material. Cover the top surface of the bow, and using the little notch, line that up so that it lines up with the patient's midline between their upper front teeth. It should set quite quickly. We'll just check it. That's set. That feels set. Right. Next we're going to put the Facebow on, and as I said before, this is technically called an Earbow because the ends seat into the patient's ear.
Right, is that comfortably in your ears?
Mm-hmm.
Yeah. The patient can help seat it if you're not sure if it's properly there. Right, then we have that properly in, we adjust the height, watching the eyes, we tighten this pointer, level with that little dot that we made earlier, and then we tighten up. There's two numbers, there's a number 1 and a number 2, so we're going to tighten number 1, no, slip slightly, number 1, hang on, it's still slipping, right. Number 1 first, making sure that this is still seated, and then number 2, and then finally I'm just going to check on here. There's a gauge. It tells you, it's supposed to tell you the intercondylar distance, that's 55, which is just spot on normal, and that's all set, so we're ready to take this out now. There we are. We separate this part, so we keep that bit, tighten 1, tighten 2. This is now ready to go to the laboratory, and that's a Facebow completed.